I started feeling what I thought was indigestion, and really suffered with that for several days.
Energetic at the office, a world traveler, and still sporting her petite schoolgirl figure, Cindy Stancill is not what you picture when you think heart attack. 4 years ago, at the age of 49, Cindy struggled with what she thought was just a bad case of indigestion.
There was nothing I could do. No amount of antacids took away the discomfort. And I finally decided I have to go to the doctor. This is just not good.
Not good at all. A full day later, news at the doctor's office floored her.
They sent me over to the emergency room, and I was told that I had had a heart attack. I looked at the doctor and I said, "You have my test results mixed up with someone else's." And he took my hand and he said, "I don't, I'm sorry." And when they did my catheterization, my right coronary artery was 99% blocked. So you can have these major events and not know it.
Cindy survived it.
Very lucky. It's not common. I mean, a lot of patients, 1/3 of the patients with heart attacks don't make it to the hospital. They die. I think she was lucky because she probably had a slowly progressive lesion.
Cardiologist Dr. Mohit Posse performs cardiac catheterizations in the Rex Hospital Cath Lab. He knows not all heart attacks are alike, though most people have one image in mind.
My idea of a heart attack was the old adage of the pain in the middle of the chest, the crushing pain, the pain down your left arm, and I had none of that.
There's about 20-25% patients that do not have these classical symptoms of chest tightness and pressure.
According to Dr. Posse, usually women, diabetics, and the elderly will have non-classic symptoms. Some may have no pain at all. His advice, don't ignore symptoms of any kind.
Any symptoms at all, whether they feel like indigestion, whether it feels like musculoskeletal pain, don't try to diagnose yourself. If they don't feel right, call your doctor, go to the emergency room. And sometimes I'll tell my patients, especially those with coronary artery disease, is I want you to think it's the heart and let me tell you it's not, because the other way is not good.
I don't think there's any reason on earth that for not going to the doctor that is worth your life. And that became so clear to me after my heart attack. People need to understand it can happen to them. I didn't think it could happen to me, and it did.
Cindy takes medication to control risk factors. She also follows a strict, low-fat, high-fiber diet with regular exercise. And she looks at the photos of the life she shares with her 2 sons and a loving husband.
And I like to look at those and think, I love this world, I love this life. I'm not ready to leave it.